Thank you, ladies and gentlemen, for coming to my speech about muscular sclerosis. People shorten it to MS also. So muscular sclerosis is a central nervous system where the white blood cells and the immune system attack the nervous system wrongfully. It thinks it's something bad when really it's something good. I have a friend named Jason Lawrence, and at the age of 33, he was a marathon runner. He was very active and ran a lot of races and did a lot of sports. And one day he just collapsed, couldn't feel his legs, and totally went numb from the waist down. And he went to the hospital, and they diagnosed him with muscular sclerosis when he was 33 years old. He's now 41, and he every year gets worse and worse. Right now he walks with a walker, and he kind of drags his feet. He can't really feel anything. His speech is slurred, and he can't really grip things because your hands will start to kind of curl after a while. But he's very positive, a positive person. He doesn't let the disease get him down at all. He still works. He can still get around pretty well. And basically, muscular sclerosis is nerve. It does damage to the nerves, but it also mainly does damage to the outer part that's kind of like a shield to the nerves. It's like a fatty substance, like a insulation that protects the nervous system. And basically, when you have muscular sclerosis, it damages these nerves right here, and basically it's supposed to look like a really nice clean shield, and this is really damaged here, which basically makes it to where you have like signals to your brain and your spinal cord. It basically sends shocks like really fast to where it doesn't have time. Like you think, I want to walk, but it doesn't get to your legs fast enough to where you actually can walk right as you think it, like we all do. And as well as your vision, it's not that great, and your speech. It's like, I want to say something, but it doesn't happen as fast as you think it, like, you know, someone without MS does. Basically, there are several treatments that the FDA has approved, 6 different types of injections, and some are pills that you take orally. It helps with like fatigue, muscle spasms, stuff like that, and can also help with lessening the disease from getting any worse and further damage, but it does not cure it at all. Some of the symptoms are slurred speech, vision, blurriness. Your balance is off. You have a lot of muscle like movements like that are uncontrollable, and stuff like that. And there's also alternate treatments that you can do. A lot of people do vegan diets where there's no animal protein whatsoever in the diet, and it seems to help quite a bit. There's a lady named Wendy Geis that she wrote in the Positive Health magazine that anyone with a very low saturated fat diet, like 20 grams or less a day, and a lot of vegetables and fruits and antioxidants, actually helped tremendously with people where their joints and their muscles didn't hurt as much and their fatigue was way down. Also, exercise is very important. Yoga really helps a lot of people with MS if they can get around it. There's some people that just can't move anymore because they get to that level, but this is for people that if they go to yoga, it helps a lot with the fatigue and brings it way down. A study was done by the Oregon Health and Sciences and University in Portland. They did a study of MS people doing yoga for 6 months straight, and their fatigue went way down lower than people that were actually on medicine for a while. So exercise is a big part of it. You know, walking, doing a lot of muscle things to strengthen yourself as much as you can. So basically, you know, there are several ways to deal with muscular sclerosis. People choose the injections and the pills. People choose the diet and the exercise. Right now, it's at a level where they can't really tell which is best, but there are some improvements, and it's just an individual basis. Not everyone acts the same. Pills and stuff like that don't help like some people, or some people the yoga and stuff like that helps, whereas it won't for somebody else. It's just an individual basis, really. I really hope that I taught some of you guys some importance of this. If you know anyone with MS, I definitely learned a lot, you know, so I can show my friend Jason some different things that he can do to maybe, you know, lessen his pain. And I'm going to end with a quote, one of my favorite quotes from Thomas Edison. He says, "The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition." Thank you.